Good morning, my dear friends. Myself, Dr. Joseph Casey. So today I am going to explain you what is Marma. That is, what is Marma therapy and what is Dawn therapy. So regarding the few glimpse of it. So Marmam, usually it has been practiced by the olden kings. It's an ancient therapy where, so if you want to hit a strong, hefty hattakata payman, so you should use a technique of Marmam by which with minimal effort you will be able to kill him or neither disable him. So there are few marmams where sadhyo kala pranahara marma, where you hit it and the person will die immediately. Kalantara pranahara marmam means you hit and he goes for 1 kilometer or 2 kilometers, he will die. So like that. Vaikalyakara marmam, you hit and his elbow or knee joint will be dislocated so that he will not be able to walk or move. So these are the few marmam points. So hence what is happening? So marma treatment or marma therapy was not taught to all of them. So it has been kept nighudate. So what happened in the British rule? So the Britishers did not want the Indian system of medicine to flourish. So what happened? So they started killing the marma therapist. So henceforth the knowledge of marmam was kept very remotely. So no one used to tell I am a marmajnani. So later on what happened? So the Siddhas in the Kanyakumari region, which they have written in their what you call Thalagiri, so which everything was preserved and it was preserved in the earthen pot, digged a well and kept inside. But later on what happened? So it ran in a family as a tradition. They did not believe it. But later on when we got independence, when we got all the freedom, slowly this Varmam art was being taken up by few acharyas, few gurus, learned the things, and now we are having all the documentation and how to proceed with it. Henceforth, whatever it is been told in Shushruta regarding the Marma chikitsa, how to use it, it is not been told in Ayurveda. So most of the Ayurveda doctors is not knowing how to use or stimulate the marmam points to get a therapeutical benefit. So now we have to understand this vermum or vital points is a deadly point, and if you trigger in a very fashionable, very slow, and there are many movements like just no vermum, just you look at that vermum points, that trigger point will be get activated and the patient heals. No vermum. Thattu vermum, that is have you just have a tap like that, the marmam get activated and it will energize the hand. So you might have seen the pilemans before going to any fighting, they used to do the tattu varmam to the chow varmam and also the ultodai varmam. They have to tap and energize all the varmams of the hands and legs to fight. And now to understand one thing, in Ayurveda it is been told that where there is a block, there is a disease. So it means that kha vaigunyat vyadihi upajayate. Where there is a block, there is a disease. So you are feeling the nadi and understanding where is the block, and if you are understood where is the block, go and tap or give a amartal. Just press and release it, amartal. So the vayu which has been tapped in one marmam point, so it will be released and the vayu will get circulated. So now the thing is that for each and every disease there is a vayu blockage. So when you understand the intelligence of the human brain and you have to go according to the intelligence of brain, then brain will coordinate all the things efficiently. And if you are using your intelligence by giving calcium tablet or painkiller tablet, so whenever you give, the patient tells, now I am okay. If you withdraw the tablet, then patient within 1 or 2 days will tell the same problem, sir, I am complaining of. So now, above that, now we have to understand what is really happening in our body, that is by Nadi. and where is the block, and you how to release that block, that is by marmam. And if at all the marmam which has gone deep inside, so that has the vital capacity of the human being is been lost day by day because of taking junk foods, thinking very bad things, that is kama krodha madamatsarya, all those things, his vital capacity keeps on lowering day by day. The marmam, that is the energy, that is called as vasi, or in Chinese medicine acupuncture we call as chi energy. So that keeps on decreasing layer by layer. In that occasion we can have the acupuncture in marmam points, and we can stimulate with electric current. The electric current which is most powerful, like the brain which is secreting the electricity in the same way when it has been researched. So when you leave that current through one end to another end, there is nerve regeneration. So what I am going to tell you is that in this seminar, if you are able to understand these concepts of how the body works, so where the compression is, how to release that, where we have to use acupuncture, where you have to use dawn, and you have to tell about dawn means it's found by dieter Dorn. Actually his wife was suffering from severe neck pain and numbness of hand and arm. So when he has shown to the doctor, doctor told that there is solution is operation, but we do not know how much we can guarantee. So when he went to some folklore practitioner, he told that yes, my knowledge I am giving to you, you will know everything by yourself. And he told that word and he died. Somehow by his grace he started doing research on it, and somehow he corrected the spinal cord of his wife, and she was okay. And his follower came later on, and there was a proper systemic study, and by which we understood that the spine, how the spine is, based on that we can understand how healthy you are. Where the nerve compression is, you will be able to understand what the probable disease you are going to get. So which things can be understood by Nadi, and also can feel the backbone, and you can understand what the patient is suffering from. All those things you will be able to understand in this class. And of course, and how to correct it, there is a systemic process, step by step process, where you have to learn by the guru itself, or else by just telling or online class will not help in any way. So I just recommending it to come over to the Punjab and learn these things practically on the patients, so that you will be able to do all the techniques of what and all I do. So thank you for seeing my video, and please share it. Have a good day. Bye.